Assalamu alaikum wa rahmatullah wa barakatuh. Hello everyone, welcome again to the series of the Painless Red Eye. And we were talking in the last lecture about the first cause of the painless red eye, which is the subconjunctival hemorrhage. And today I will show the second cause of the painless red eye, which is episcleritis. If you remember, the subconjunctival hemorrhage, the patchy red sector or part of the white of the eye. But the second cause, episcleritis, you will find here the picture is different than the previous one. There is engorged blood vessels present around the limbs and radiating towards the lateral angle of the eye or the medial according to its presence, but is commonly presenting in the outer part, the outer half of the palpebral fissure, as you see. The episcleritis is typically more uncomfortable, but not frankly painful. The patient will complain of discomfort, but not pain. It's not painful. On examination, you will find that the sectoral area of hyperemia, this is hyperemia with obvious red dilated superficial vessels. It's limited to the subconjunctival vessels with subconjunctival injection. It's not congestion, it's injection because it's an inflammatory reaction. So there is subconjunctival injection of the superficial subconjunctival vessels. In the episclera, there is a space between the conjunctiva and sclera. There is a subconjunctival tissue, which is a tenon, and episcleral space. So these vessels called episcleral vessels with subconjunctival injection. In episcleritis, injection is superficial, and so it's movable. You can move it. You can move these blood vessels if you use the swab or the cotton buds with a topical anesthesia like pinoxynate. And on moving the conjunctiva, you will find that the blood vessels will move with the conjunctival movement. So it's movable blood vessels, so it's superficial. And this is one of the signs of episcleritis. It also plants with phenylephrine application, which is a vasoconstrictor. A vasoconstrictor, on installation of drops of the vasoconstrictor like phenylephrine, you will find that this red sign will disappear, and these blood vessels will constrict again in response to the phenylephrine or vasoconstrictor. And it's another sign for the episcleritis to differentiate it from the scleritis. It's superficial, so it can be moved by swab. Also, the blood vessels will constrict in response to topical vasoconstrictors. So these two signs are differentiating the episcleritis from scleritis, which does not obey the rules above. It doesn't move with the swab or plant with adrenaline. It's usually frankly painful, which I mean the scleritis is frankly painful. But in episcleritis, there is no pain, just discomfort. Causes of episcleritis, it's not obvious. There is no obvious causes for episcleritis. Though symptoms tend to recur and the disease is associated with some systemic autoimmune conditions in 30% of cases, such as ulcerative colitis. So I consider that the episcleritis is one of the autoimmune signs in the eye for autoimmune diseases elsewhere, like ulcerative colitis, like ankylosing spondylitis, like the autoimmune inflammatory joint diseases. The management of episcleritis, there is no specific treatment, so don't be hurried to prescribe corticosteroid eye drops for such patients, because it's very mild problem, and you have to spare the steroid for the major problems. So I prefer to just give this patient lubricant. I may give this patient systemic anti-inflammatory or analgesics with topical lubricants, and may give this patient like the non-steroidal anti-inflammatory eye drops. But in severe cases or long-standing cases, the oral steroids or the topical steroids may be considered, with oral and typical non-steroidal anti-inflammatory drugs may be required in such conditions. So put in your mind about the episcleritis that it's movable blood vessels. It plants on with adrenaline eye drops or phenylephrine eye drops. Also, it's not painful. It may disappear with no treatment within a few days or week. It may respond to the systemic treatment with non-steroidal anti-inflammatory drugs, with no need for the topical treatment, just lubricants to relieve the discomfort for this patient. Thank you so much, and see you in the third course of the painless red eye.